All right, good evening, everyone. My name is Holly. I'm an occupational therapist assistant and physiotherapist assistant student from Niagara College. Just want to welcome everyone to my short webinar tonight. I want to welcome all my fellow physiotherapist and occupational therapist assistants, as well as any students that are also, like myself, in college. So this webinar tonight, I'm going to talk about telelrehabilitation. So essentially, I'm going to begin talking about a little bit. Then I'm going to be talking about the age group of the clients that would be most appropriate to receive telerehabilitation. And I'm going to get into what are some key considerations for us as PTAs to know when providing clients with this form of treatment, as well as I'm going to briefly discuss how we should prepare ourselves to deliver these services remotely during, of course, this pandemic of COVID-19. And also, lastly, what tools we could use to continue to provide the best treatment possible. So we're just going to begin with, again, what is telerehabilitation? So it's a form of virtual care that incorporates the delivery of physiotherapy treatments via online to patients that they can access from the comforts of their own home. It includes an interview with the patient, an assessment and consultation, creation of a treatment program, education, and training. So as physiotherapists and occupational therapist assistants, we would be the ones that would receive this treatment plan from either the physiotherapist or the occupational therapist, and we would be carrying out this treatment program with the clients, again, via online. So, the clients that we would target for this telerehabilitation would be mostly, I'd say, patients that actually have access to a laptop or computer and who are comfortable and confident when working with computers or other modes of technology. So again, as I'm a person from this new technological age, I'm in my mid-20s, so I believe that school-age children, including elementary and near the end of elementary school and high school students, as well as college and university students, being the young adult age group, and older adults between the ages of 50 to 65 should be able to access these physiotherapy appointments online. I believe any people over the age of 70 and over might have a little more difficulty accessing these services online. Therefore, if they have a caregiver present, then this would really help them to be able to access their appointments online and perform the treatments provided by the PT or the PTA. So some considerations that we should consider as physiotherapy assistants is that with every treatment and treatment session provided to our clients, we're expected to follow the College of Physiotherapists of Ontario standards and expectations. So we as PTAs, we have to remember to treat every patient, regardless of their race, ethnicity, religion, or sex, with respect and kindness, as what we learned in our educational background as well. So we have to provide treatment that is safe, reliable, and we need to ensure that all client information that we do discuss during the session is kept confidential and not shared with any other outside health professionals. So I'm going to talk about how we can prepare to deliver this particular treatment session. So first, we can ensure the client has access to their appointment online. Then we can ensure that the client has consented to receiving this treatment delivered to them online, and that they understand that during this time, their treatment can't be delivered in person, and that we both have to have a stable connection in order to properly communicate and have a proper session, and that we as PTAs also have to have a plan in place to know exactly how the session is going to go. So near the end here, I'm going to say that we need to figure out tools that we can use to help us better treat patients virtually. according to telerehabilitation guidelines. So we can use tools such as the Canadian Physiotherapy Association, as well as the College of Physiotherapists of Ontario websites, which I hope you'll check out after this webinar and be able to find some more key information about how to be more professional and make sure that your practice is in line with all the standards that are enlisted by the colleges. So that pretty much concludes our my short webinar, I should say. I hope everyone has learned something. I appreciate you for taking the time to come online and listen. And again, I recommend that you check out those resources that I mentioned. And that's about it. So goodbye for now. Thank you.